Good afternoon. Welcome to coronavirus update. Today, up-to-date news from the Bangkok Post. It is the virus spreading around the world, not only our country. If we discuss about the pandemic, the outbreaks of coronavirus, which spread quickly. And discussing about our country today, the meeting among the concerned people, especially Public Health Ministry on Tuesday. Today report 3 more deaths of coronavirus disease. One person died long ago, and then it prolongs for almost 2 months. Today, 2 deaths. And 3 deaths, sorry, not only 2 deaths. 4 people died in our country because of coronavirus, increasing the toll to 4, clearly seen here, to 4. And one day today, 106 new infections, raising the total numbers of infections in Thailand, 827 people. The numbers of these confirmed cases, the numbers of new confirmed cases was lower than 122 record on Monday yesterday, but still high. Dr. Thawi Sin, spokesman of ministry, said that 3 new deaths were Thai men who suffer from underlying health conditions, those who die not only because of the infected of the coronavirus, but also from their disease. Another was 70 years old this morning, suffered tuberculosis for a long time, and another was 79-year-old Muay Thai guru who had several chronic diseases and was admitted for treatment on March 16 recently. Both were at Bamrung Rat Nadu, one Bamrung Rat Dun, maybe infectious disease institute in Nonthaburi province. This hospital takes responsibility on the disease. We have to thank the hospital and hospital staffs to do this. And the other days was 45 years old who had suffered from obesity and diabetes, who has been treated as private hospital in Bangkok. The first group numbers, I have to jump from this news because this is not important. I would like to update it. Before that, a few days ago, the government, especially the Bangkok governor, announced to close many important areas and buildings in Bangkok. For example, supermarkets, department stores, etc. And many companies also overseas to hold during this time to protect people from infection. But it is vice versa. Maybe it is beyond the government and the governors, Bangkok governor, to think about, because people are not objects. They move. They transfer from one place to another place. Especially for medium was poor people, then medium income people who have to rent the house. You have to rent the house and work daily to earn for living. They don't have work to do because of their company is closed. They don't have anything to earn money for, but at the same time their expenses still be the same or maybe increase. They have to pay for the rent without mercy from the landlord. They have to pay for electricity, water supply, and even the stuff for eating. How can the poor people survive in this situation? That's why the people, maybe all of them, some of them, many of them infect the disease. Nobody knows. Maybe the symptoms is not yet appear. Maybe they do not know about that. Maybe some infected, many not infected, but now they separate, not isolate. They separate themselves from the capital city of our country to all directions, their motherlands. The government cannot claim, cannot complain, cannot blame them that. The government cannot blame them that. Why do you spread the virus around the country? Because they don't have the tangible practice for the people to follow. And at the same time, they don't close the movement of the people, not like some other countries. I show you the example of China. Stop, close mean close. It doesn't mean that you can transfer from one place to another place. People have to transfer because they live without future. They remember, they recognize, and they miss their parents, children, so they have to move from Bangkok without the announcement from the government or the governors that you can't move. They can't come in because nobody believes that, nobody thinks that I am infected with the coronavirus. Nobody think about that. People always think that I am not infected. Yes, I can't live in Bangkok anymore because the disease is here, outbreak here. I have to leave from my home. People think like this. And at the same time, they close for a long time. I have to save some little money I have back home to my parents. The government has to, I do not know when they think, they must think beyond ordinary or individual to think about. Number one, the first plan is close to the important places. Number two, they have to plan for how those people survive, how to subsidize them. Maybe they initiated, establish the subsidized center for food, etc., etc., and medical checks in Bangkok, and guarantee that nobody move from Bangkok. That is the beginning. They have to do at the same time, not coming to do after, because the outburst of the virus will destroy not only the people but economy too. Come to the final solution just few minutes ago from the Bangkok Post. Of the total number of 827 infections, 55 people have recovered and they have been sent back home, including 5 on Monday. A further 766 remains at the hospital, including 4 severely ill patients on respirators. 8% of patients were in good condition. Thank you, doctors. Very nice also. This time it's time for supporting doctors to work harder and hardest. They are working hard. They risk their life. The doctor, maybe because some patients, or maybe the relative of the patients, or allow there without informing the doctors of their risk. That's why doctors, nurses, and the concerned parties are in danger. We have to thank the doctor, thank you them all. Epidemiology Director of the Disease Control Department said COVID-19 had now spread to 47 provinces, including the province I am living, Konkan province, with Bangkok, especially its boxing stadium. Why not those people who watch the boxing stadium, Lumpini or somewhere else, not isolate themselves for 14 days to check themselves? Why not? Why move like this? This is a big problem. Not only little coast, but now the big problems for the country. Epicenter from boxing stadiums. Now the government closed. What about those people who were in the stadium before? Where are they right now? Maybe they convey the disease to their parents, to other unconcerned people, uninvolved people around the country in their native. If the government couldn't find those people right now, we can't imagine how the disease will spread, how fast. The transmission, let's see this one. It is important to see how dangerous the disease is. In Spain, 6,000 people died, more than 6,000 people died. The number is outnumber China death Chinese people. The transmission rate in Bangkok was estimated to be 1 to 3. Mean if I infected, I can transmit the disease to 3 others. Each infected person transmitted to 3 others. The explanation is 1 infected person can transmit to 3 other persons. That's why we have to stop those people. While the rate in other provinces, like in some in provinces, 1 to 2, quite dangerous. 1 to 2 mean I can transmit to 1 person, and 1 person, that person also transmit to like this. Mushrooming in the near future if the government cannot handle this problem properly and quickly enough. This is the global transmission rate. The comment was to meet to discuss additional measures to cope with the coronavirus pandemic. Later on Tuesday, they have to discuss and find the way to solve this problem. And at the same time, we have to isolate ourselves from socialize with friends. We can socialize with friends through media like this. And this is an opportunity also for people to stay home with their beloved people, and at the same time read the books, do things we intend to do long before. And keep in mind that the economy after this one year we will suffer a lot. We have to maintain our condition and try to help ourselves as much as we can. I hope the Buddha save all of us, and all of us will be saved by our activity, not socialize, not going out often, and protect ourselves. Even the mask quite difficult to fight, and even we fight, but it's quite difficult. It's quite expensive. So the government have to do this. Can you provide, not for free, can you provide the mask for people to buy? I don't say free because we don't need your money. It is our money, but manage this one. Provide opportunities for people to buy the quality mask. That's why they can protect themselves, not spreading the coronavirus. All of us safe wishing. See you next time. Bye bye.